a small volume neb or a mini heart requires oxygen or flow. Aerogen does not. So, with that being said, you're going to see a lot of reduced waste in medication with this guy. You're going to see increased delivery as well. Hence why we want to use this particular nebulizer for that Flolan medication, which is, I have to say, from a commercial standpoint, it is off-label drug. However, you have to reference pharmacy for any type of dosing or anything like that. However, what I'm going to be able to talk to you about today is running a solution or a liquid through my nebulizer, basically, and how to set that up in a continuous setting. But also going to show you various placements and where a lot of critical care units across the country, where they utilize Aerogen, because it's become such a common practice among in the ICU across the country. About 90% of critical care units in the U.S. right now use Aerogen as a standard of care, just on their vented patients, just for standard treatments. That doesn't necessarily include a pump, just for dropping regular meds and going, because it's super easy, right? So with Aerogen, this is the Aerogen Solo right here. This is your actual nebulizer. It's going to take the place of, I believe, you guys are using a mini heart right now. Is that? We're not starting right this minute. However, we are targeting a date before the new year to get this started here in Q4 of the year. Could be in November, could be in the beginning of December. I'm not quite sure yet. So I will be back again as we launch this out. So just FYI. So, as I mentioned, it doesn't require oxygen, it doesn't require flow to generate aerosol. It has a little bitty metal plate on the inside right here. And I can pass that around if I want to take a look at it. And in that little metal plate, there's about 1,000 little stamped holes. And when electricity is connected to that nebulizer, it's vibrating 128,000 times a second. So, as you can imagine, once liquid medication passes through that little metal plate, you're getting a particle size unmatched by any other aerosol device. About 3.1 microns on a particle size. So, as you guys know, referencing back to respiratory school, we have a couple students here. In Egan's, 1 to 5 is where we want to be, right? And we're smack dab right at about 3.1 mics on a consistent basis. Great for patients in critical care, but also in the ED setting too. If you have an asthmatic who comes through the ED, you're going to see patients turn around much faster because they're getting so much more med. You have less than 0.1 mLs of residual volume through that too. Just a quick guess. Anybody know how much residual volume you have left in a small volume nebulizer or sputter? About 60% of the med. So you can see, yeah. So with those things, they're very wasteful because they have a minimum fill volume, right? Where Aerogen does not have a minimum fill volume. You don't have to have additional solution. However, people do run your standard 2.5 ml through here, right, with this saline. But you don't necessarily have to have that. So that's the main part of the system right here, right? So as we know, way more efficient. That's why we are going to be running it with our continuous setup. But this is your Aerogen controller right here. I know you said you used Aerogen before. Well, we have one in the room anyway. So this is your box that powers your nebulizer. This is your cable right here, your white cable. They have two very distinct ends. You got a square and a circle. Your square end fits into your disposable just like that. And your circle end is right into the base of your controller. Then you've got a power cord as well. It's like power cord. Will actually, I'm going to hang it up a little bit, fit into the side of your controller right here. What am I doing there? Your power cord just fits right into the side, and you'll just plug that in like that. Boom. So, I mean, essentially, you've got just to aerosolize. You've got everything hooked up that you need now. All right. So, once you have that in, then you would just hit your button, and then you have aerosol. It's super quiet. I don't add any more noise to the room. Right. That's just to get to your 30-minute mode. That's just if you're running an intermittent treatment, like standard treatments on your vents, which we're not doing quite yet. But just something to note, when you do power that on 30-minute mode, what that means is that's a timer. So, which is great for your, like those facilities who are trying to increase workflow and things like that, because once you place this in line, you don't take it out. You leave it in line because it's a closed system, like you're accustomed to with small volume nibs. And then your controller cuts itself off. So what a lot of people like to call this is the drop and go system. Essentially, you just come in, drop your mid, hit your button, go see your next patient. Super easy. And then you have what we're going to be talking about today, continuous mode. That's going to be your second option, okay? So starting from the off position, you're going to hold this blue button down. We only got one button, can't really mess it up. You hold it for about 3 seconds, and then it's going to populate down to continuous mode at this point. Everybody can see that light in the back? Okay, great. So we're in continuous mode now. You see we're rolling. Something to note with continuous mode, we have to stay plugged in to power at all times for continuous mode, okay? So just think continuous power, continuous mode. Because this controller does have a battery life in it as well. It will last you about 45 minutes, however, but it will cut off. And for this protocol that you guys are about to jump start here in the next month or so, this it's imperative, because if this nebulizer cuts off and the pump is still running, we've got an issue, and there's going to be a bolus of medication. Because just because your controller cuts off doesn't mean your pump cuts off. This is still pumping med, but your mesh plate's not vibrating. So we've got a whole problem there. We have to dump out medication because we don't want to bolus them with this type of medication. Okay. So, questions so far? Good. All right. So we've got that all hooked up there. So I'm gonna come back over here. All right. So we've talked to that piece. We're gonna leave these things bracketed at all times, okay? Because if we just go over here and say we lay it on the, well, I probably got that dripper on there. But if we just go over here and lay it on top of the pump, or we lay it on top of the ventilator, and that thing falls and hits the ground, you don't have about 1 or 2 good drops in this thing. There's a little circuit board on the inside. It's gonna start sounding like a couple of dice rolling around on the inside, and at that point, you're kind of out of luck. So you need to go grab a new controller. I think I'll have a couple, but I'm not sure where they've stashed the other ones. Yep. So troubleshooting wise, with this guy, we do not have an alarm. We do have a visual cue though. We didn't think you guys needed another alarm in the rooms. So when this guy is on right here, and you see a little light pop on in the corner, what that means is you have a disconnection somewhere, okay? So first you want to check at the disposable end right there, and then you'll just check at the base of your controller, okay? You guys have some relatively newer controllers, so you shouldn't have an issue with this yet. However, it is essentially kind of like an iPhone charger, right? Or your cell phone charger. Over time, these guys, as they get used more and more, will eventually kind of wear out, right? Have some wear and tear there. So just be mindful. So if you've done both of these troubleshooting options here, maybe just try a new cord at that point, okay, before taking your controller out. But medication. So Flolan is a thick, viscous type of medication, okay? And as I mentioned earlier, we got about 1,000 little precision holes in that little metal plate. You can't even see it, they're microscopic. Recommended in between each syringe that we keep a little saline bullet on us, and just put a couple drops of saline through here. What that's going to do, it's just going to flush that plate out and keep it from gunking up, because it will. Y'all run some like pulmocords, you can miss things like that through those nebulizers, hypertonics. So you'll actually start to see that gunk up. Your hypertonic will actually start over time if it's not maintenance properly.